Good evening. In this video, we will see regarding one common DM conceptual question. If you are a DM resident, you might have encountered this question: when to say as obstructive uropathy and when to say as obstructive nephropathy. Even though the terminologies appear similar in the exam, the question might be bombarded on you, especially in the long case or in the practical viva. Why you are saying this as nephropathy, not as uropathy? So that we will see in this video. Obstructive uropathy are very common, up to 10% of the acute kidney injury or even CKD cases. Obstructive uropathy obstruction is the cause of the renal dysfunction and is one of the important reversible cause of acute kidney injury. And even if the patient is in CKD stage 3 or 4, if the obstruction is relieved, there is a significant chance that progression might be delayed. So first, what is this obstructive uropathy, or what is this obstruction basically indicates? We can use this as a definition. The obstructive uropathy can be defined as a structural or functional obstruction to the urinary flow. Basically, the flow of the urine is being obstructed. So that is obstructive pathology. Where the obstruction can happen and why they are using two different terminology, uropathy or nephropathy. To understand that, what happens when there is obstruction? The urine being produced in the kidney through the pelvic callosal system goes to the bladder, urethra goes out. Whenever there is obstruction at any point of this pathway, bladder, ureter, or in the pelvic callosal system, initially there are some mechanism in the form of kidney goes for some kind of swelling, the ureter gets dilated, which we term it as hydroureteronephrosis. Till the time the kidney might able to maintain its function up to a particular point of time, after which the homeostasis mechanism will be lost. So when the obstructive uropathy or the obstruction to the flow is significant, the kidneys will go for a dysfunction. That is, GFR will come down, the patient electrolytes will face abnormal levels, there might be development of metabolic acidosis. So these are all the problems in a long-standing obstruction, or if the obstruction is severe, even in an acute situation. So when the kidney goes for a dysfunction, then we term that as a obstructive nephropathy. Because of the obstruction, the kidney went for some kind of dysfunction, then we term it as obstructive nephropathy. What uropathy indicates? Uropathy basically indicates obstruction to the urinary flow, either structural or functional. Which is more common? Structural is more common rather than the functional abnormality. So I hope this question you are able to answer now in your viva. This obstructive uropathy, it is a blockage to the flow of the urine. Whenever there is a structural or functional obstruction to the urinary flow, we call it as obstructive uropathy. If the obstructive pathology leads to the dysfunction of the kidney function, if the obstruction leads to dysfunction of the kidney function, then we will label it as obstructive nephropathy. Again, I am saying this is just a block to the urinary flow. This is renal dysfunction. Renal injury secondary to the obstruction will label it as obstructive nephropathy. So just one more concept we will see. What are the classification system we will use for obstructive uropathy? So in the description, since I told the flow is obstructed, there are four kind of classification we can use based on the duration, whether it is acute or chronic. How long the period, based on that we can say it as acute or chronic. The second one, whether it is unilateral or bilateral. As we know, the kidneys are a paired structure. Whether only one kidney is involved, two kidneys involved, you can label it as unilateral or bilateral. The third classification is partial versus complete. So what is the meaning of partial? There is, for example, a stone. Stone obstructs only the half of the ureter. Probably it is the partially obstructing the urinary flow. This is called as partial. If it completely obstructs, then it is complete. So this is the third classification we will use. Why these are important? These are important in the management, how to plan, what are the intervention to be planned, all depends on these. The fourth one is the intrinsic obstruction versus the extrinsic obstruction. Intrinsic in the sense within the pelvic alical system or within the urine flow tract, whereas extrinsic, for example, is any retroperitoneal fibrosis or some kind of aortic aneurysm, some external such structure which are not related to the kidney, ureter and the bladder is causing the obstruction, which is called the extrinsic. So it can be intrinsic or it can be extrinsic. And one more which we commonly encounter is the upper tract versus the lower tract. The kidney and the ureter, if there is an obstruction over there, we will call it as upper urinary tract, whereas the bladder, prostate and below urethra, we call it as lower urinary tract. So these are all the common terminology we use to classify the obstruction so that that treatment can be planned accordingly. So what are all the few examples which we commonly encounter clinically? Starting from the kidney, most commonly stones, clot, papillary necrosis, in the urethral, any kind of tumor. So retroperitoneal fibrosis, which is the external cause, any localized tumor which is developing and compressing the localized structure, uh, make out based on the anatomy of the kidney. In the bladder, any bladder mass, urethrocoel, prostate, most common above the age of 16 males, urethral meatus, urethral stenosis. You can make out the causes, and there are many textbooks which give it in the tabular column. You can go through it. So I hope the concept of this obstructive uropathy and obstructive nephropathy is clear. The purpose of video is to just to give answer to this uropathy versus nephropathy. Obstruction to the flow, renal dysfunction resulting because of that. I hope it is clear. Bye bye. We will see in the next video.